Hi, my name is Brendalyn Tavel, and I'm a board-certified family nurse practitioner. I grew up here in San Antonio, Texas. I joined the Army, and I traveled all over. I got my nursing degree from George Washington University in Washington, D.C., and after I became a registered nurse, I then became a family nurse practitioner. I worked in cardiology early on in my registered nurse career, and I fell in love with it, and it's something that I really wanted to do as a nurse practitioner. I was originally a logistician in the Army, and when I left the Army on active duty, I wanted to find a new career field, and nursing was something that always kind of spoke to me, and the people in my life were like, "You'd be an excellent nurse," and so I went into nursing, and I fell in love with it, and for me, bedside nursing was great, but I wanted to be able to serve them in a different way and be a different kind of member to their interdisciplinary team, and that's when I decided to pursue my master's in nursing and become a board-certified family nurse practitioner. My practice philosophy is all about patient-centered care. I believe that the patient should be incorporated as the center of the care team so that they can have buy-in and they really understand why they're being asked to do what they're being asked to do, why they're taking the medications they need to take, all the other non-pharmacological interventions, daily weights, and their diet changes and exercise being incorporated into their lifestyle. When they're at the center of the team and we meet them where they are, we just have better outcomes in general. And that's something that has always been a philosophy of mine, whether it be a bedside nurse, as a bedside nurse, or as a nurse practitioner. The typical cardiac patient that I've worked with in the past has been primarily advanced heart failure patients, also patients who are being seen after maybe a heart attack, patients that are having chest pain that we're monitoring, that we're really trying to work with medication management and lifestyle changes so that they don't progress in that and doesn't turn into a heart attack. But that's kind of like the patient profile. And then you also have the electrical components of the heart, the people who have atrial fibrillation and different kind of arrhythmias that I've also worked with before. Things I want people to know about me as a provider are that I genuinely care about my patients. I want them to feel seen. I want them to feel heard. I don't want them to come into the office and ever feel like they're being rushed or that they're being given a treatment that they don't understand or they don't agree with. I want them to feel like they're in control of the treatment plan. I am so excited to join the team at North Central Baptist in cardiology. I'm excited to meet you guys, and I'm excited to be a part of your care.